Patient admission. Cancer patients who will undergo chemotherapy session and are for admission can come from A. Cancer Center and B. Admitting section, where in that case, they will serve as a direct admission. If the patient is coming from the cancer center and will be admitted to the ward, expect that his or her chemotherapy infusion is already started. On the other hand, if the patient is coming to the ward as a direct admission, the chemotherapy infusion will be facilitated at the patient's room by the bedside nurse. Let us take a look on the step-by-step process on how to facilitate compounding of chemotherapy drugs. The first thing the bedside nurse needs to do is to read the patient's chart, especially the chemotherapy order, and make sure that the consent for chemotherapy is signed by the patient or a representative. This is the informed consent form for any treatment or procedure like chemotherapy. Make sure that the identifiers above or the information that is being asked are complete before letting the patient sign. The name of the attending physician or the oncologist should be written. Put a check mark on the chemotherapy option. Let the patient or a representative sign. On the lower part of the consent form, the doctor or the resident on duty should also sign, and a companion will serve as the signing witness. This is the chemotherapy order sheet. In here, the chemotherapy orders should be correctly and completely written by the doctor. This needs to be accomplished prior to chemotherapy mixing. On the lower part of the form, the oncologist or the resident doctor should sign. Let's have a closer look of the form. The chemotherapy order sheet is a 3-page carbonized form. The front page is attached on the chart. The second and the third copy will be given to the cancer center and oncology pharmacist respectively later on. Fill out the order sheet with the information being asked. The initial vital signs should be taken and written to ensure that the patient is stable and with no fever. The main line or IV solutions that will be infused together with the chemotherapy drug is clearly written below the initial vital signs. For this example, the doctor ordered D5W or D5 water, 500 ml for 40 cc per hour, while on oxaliplatin, then shift to plain NSS 1 liter for 60 cc per hour during leucovorin and 5-FU infusion. Below that is the pre-medication section. Under pre-medications, the name of the medicine should be written together with the amount or dose and route. Remember that pre-medications for chemotherapy are given 30 minutes before chemotherapy infusion to reduce the incidence and severity of infusion-related reactions. Below the pre-medications are the chemotherapy drugs to be administered. First column is the name of the medicine. Next is the dose per kilogram, which is computed by the oncologist. The final dose, the route, the total volume of the solution where the chemotherapy drug will be diluted, and the duration of the infusion. Let's take this example. The first drug to be administered is eloxetine or oxaliplatin with a final dose of 150 mg through IV to be diluted in 250 ml D5 water and to be infused for 2 hours. The next drug is leucovorin, folinic acid, 100 mg IV in 100 cc NSS for 15 minutes. 5-FU 400 mg IV through SIVP or slow IV push. And lastly, 5-FU 600 mg IV in 1 liter plain NSS to be infused for 24 hours.
After making sure that your chemo order sheet and your consent are already accomplished, you may now start to insert your peripheral access so that you can start your hydration or mainline as ordered by the AD. Please take note that before you go down to the cancer center and let the oncology pharmacist mix your chemotherapy drugs, first, you must have inserted a peripheral vascular access to your patient or let the resident on duty access the portacat of your patient.
Aside from the chemo order sheet and the informed consent, you also need to prepare your other materials needed. Your Hospira plum, your mainline, and the diluents and safe set for mixing. So let us prepare the other materials that we need for your chemotherapy compounding. These are the diluents wherein the chemotherapy drugs will be diluted. It is the responsibility of the bedside nurse to endorse it to the oncology pharmacist. We use 2 types of tubings for your chemotherapy drugs. The first one is the Intrafix Safe Set. This is the most commonly used tubings. If the chemotherapy drug needs protection from light, we use these orange-colored tubings. It is called the Infusomat Spaceline UV Protect. It is designed for light-sensitive drugs. The Hospira Plum is the machine we use for chemotherapy infusions. This machine can run 2 solutions at a time, which is ideal for chemotherapy infusions because during the treatment, a mainline and a chemotherapy drug is being infused to our patients at the same time. This is the port where we will connect our chemotherapy drug later on. This is our mainline D5 water and is ready to be administered. Side A is for your mainline. And side B is for another solution, which is your chemotherapy drug. Let's input on your side A. The doctor's order is D5 water 1000 ml to run for 80 ml per hour. So it's already pumping and we can now start hydration to the patient while we go down to the cancer center for the mixing. Let us have a review on the things you need to bring to the cancer center for chemotherapy drugs compounding. First is the informed consent, which is signed by the patient or a representative. Second is the chemotherapy order sheet. And third are the diluents and the tubings for mixing. Once these 3 are complete, you can now go down to the cancer center for the compounding to be done by the oncology pharmacist.
So once you are ready with your consent, chemotherapy order sheet, and your other materials for mixing, you can now go down to the cancer center and endorse it to the oncology pharmacist. And you just wait for their call once your chemotherapy drug is already compounded.
A few moments later.
The compounding of chemotherapy drugs takes about 1 hour to 1.5 hours. Once the chemotherapy drug is compounded and is ready to be picked up, the pharmacist will call the unit and inform them that the compounded drug is already for release. The bedside nurse is the one allowed to pick up the ready-to-infuse chemo drug. The oncology pharmacist will endorse the compounded drug to the nurse, making sure that it is the right drug for the right patient.
Phosphate po, ito po. 900 milligrams, DMD5 water to 50. Tapos ito po yung after cycle na naman na 400 milligrams. 10 to 50 ml. Tapos ayun na lang ito. Tapos mo, hindi na kasi
We use the nitrile gloves when handling hazardous drugs, such as your cytotoxic and chemotherapy drugs. It is recommended that 2 pairs of chemotherapy-tested gloves should be worn for all hazardous drugs handling activities. Change your gloves every 30 minutes or immediately if damaged or knowingly contaminated. Gloves must be disposable and powder-free. It is made from nitrile, neoprene, or latex. Don your nitrile gloves. Please do not touch the compounded drug with your bare hands. Do you remember your pre-medications before starting your chemotherapy infusion? When is the best time to give them? Please take note that your pre-medications should be given 30 minutes before starting your chemotherapy infusion. Once the oncology pharmacist calls the unit and informs you that the chemotherapy drug is already compounded, that's the right time to give your pre-medications to your patient before going down to the cancer center and picking up your chemotherapy drug. Double checking prior to hooking of chemotherapy infusion. Prior to starting the infusion, the compounded drug needs to be double checked by the bedside nurse with the charge nurse or a senior nurse. They will double check the patient's name, birthday, medical records number, and most importantly, the name of the drug, dosage, and duration of infusion. We can now go to our patient and start her chemotherapy regimen. Check the identification band of the patient for verification. For new patients who will undergo chemotherapy session, anxiety is normal. The nurse can talk to the patient to help them feel relaxed and more comfortable. Hook the drug and connect it to the side B port of the plum. Input the needed information. This infusion is oxaliplatin 150 mg in 500 ml D5 water for 2 hours. Input the total VTBI or volume to be infused, which is 500 ml. The duration is 2 hours. Make sure that it is pumping and infusing well together with your main line. We can inform the patient on how long the infusion will be or the expected time of end of infusion.
Where to dispose them.
Disposal is needed for staff and environmental safety. Unhook the empty chemo bottle. Put it inside a Ziploc to contain before going out the room. The orange waste bin is the designated color for disposal of cytotoxic wastes. Place the empty bottle inside and remove your gloves. And lastly, do your hand washing.
You must know the protocols and procedures of the institution with regards to its chemotherapy. An oncology nurse requires to care professionally and emotionally. We can't save everybody, and it's a fact of life. But what matters is the time we spend with those people and how we touch their lives and make them better. As oncology nurses, we support the fighters, We admire the survivors. We honor the taken. And we never ever give up hope. Thank you and have a good day.